Female infertility. Common causes. Female infertility is a significant health issue affecting approximately 10 to 15% of women of reproductive age worldwide. It is defined as the inability to conceive after 1 year of unprotected intercourse. There are many potential causes of infertility in women, which can stem from issues related to ovulation, fallopian tubes, uterus, hormonal imbalance, and egg quality. Understanding these causes is crucial for accurate diagnosis and appropriate treatment. The most common causes of female infertility include 1. Polycystic ovary syndrome, PCOS. PCOS is one of the most common causes of infertility in women and is characterized by hormonal imbalances and metabolic problems. Symptoms: irregular or absent menstrual cycles, excessive hair growth, hirsutism, acne or oily skin, obesity in some cases, impact on fertility and ovulation. Women with PCOS often have difficulty ovulating, which means eggs are not released regularly from the ovaries, making conception difficult. Increased androgen levels. Elevated levels of male hormones like testosterone can interfere with ovulation and disrupt the menstrual cycle. Ovarian cysts. Although not always the case, many women with PCOS have cysts on their ovaries that can contribute to fertility issues. Treatment options: clomiphene citrate, Clomid, a medication that induces ovulation. Metformin, used to improve insulin sensitivity, which can restore regular menstrual cycles. Gonadotropins, injectable fertility medications to stimulate the ovaries. In vitro fertilization, IVF, used when other methods fail, particularly for women with severe PCOS. Second, endometriosis. Endometriosis is a condition in which tissue similar to the lining of the uterus grows outside the uterus, commonly affecting the ovaries, fallopian tubes, and the pelvic lining. Symptoms: painful periods, pelvic pain during or after intercourse, painful bowel movements or urination, heavy menstrual bleeding, impact on fertility, scar tissue and adhesions. Endometrial tissue outside the uterus can form scars and adhesions that may affect the fallopian tubes and ovaries, interfering with egg release, sperm transport, and embryo implantation. Ovarian cysts, known as endometriomas. These cysts can affect ovarian function, reducing egg reserve and quality. Treatment options: laparoscopic surgery to remove endometrial growths, scar tissue, and adhesions. Hormonal therapies to regulate the menstrual cycle and reduce endometrial growth. AVF, often used if other treatments are unsuccessful, especially in severe cases of endometriosis. 3. Tubal factor infertility. Tubal factor infertility occurs when the fallopian tubes are blocked, damaged, or absent. The fallopian tubes are essential for transporting eggs from the ovaries to the uterus, where fertilization occurs. Causes: pelvic inflammatory disease, PID, a common cause of fallopian tube damage, often due to sexually transmitted infections, STIs, like chlamydia or gonorrhea. Previous abdominal or pelvic surgery. This can lead to adhesions or scar tissue that block the tubes. Endometriosis, As mentioned earlier, it can also cause tubal damage through scarring. Treatment options: tubal surgery to clear blockages or repair damaged tubes, although surgery may not always be successful. IVF. If the damage to the tubes is extensive, IVF is often the best option to bypass the fallopian tubes entirely. 4. Uterine anomalies. Uterine anomalies, including structural problems such as fibroids, polyps, and congenital uterine malformations, can impair a woman's ability to conceive or carry a pregnancy to term. Types of uterine anomalies: fibroids, non-cancerous growths in the uterus that can interfere with implantation or cause miscarriage. Polyps, growths in the uterine lining that can cause abnormal bleeding and disrupt implantation. Congenital uterine abnormalities, conditions such as a septate uterus or biconjugate uterus, where the uterus is malformed or divided, making it harder to conceive or carry a pregnancy. Impact on fertility: impaired implantation. Fibroids and polyps can block the uterine cavity or disrupt the endometrial lining, preventing the embryo from implanting. Increased risk of miscarriage. Certain uterine abnormalities increase the likelihood of pregnancy loss. Treatment options: surgical removal of fibroids or polyps using hysteroscopy or laparoscopy. Surgical correction of congenital uterine anomalies, often done through hysteroscopic surgery or laparoscopy. IVF. In some cases, IVF may be recommended to bypass uterine issues if surgery is not effective. 5. Diminished ovarian reserve. Diminished ovarian reserve refers to a decrease in the number and quality of eggs in the ovaries. This condition is common as women age, but it can also occur in younger women due to genetic factors or previous medical treatments. Causes: age. As women age, the quantity and quality of eggs decrease, which affects fertility. Genetic conditions such as Turner syndrome and Fragile X syndrome. Chemotherapy or radiation. These treatments can damage eggs and decrease ovarian reserve. Autoimmune disorders can also lead to early ovarian failure. Impact on fertility: reduced egg quality. Older eggs are more likely to have chromosomal abnormalities, leading to difficulty in fertilization and increased chances of miscarriage. Increased difficulty with conception. Diminished ovarian reserve can result in a reduced ability to conceive naturally. Treatment options: IVF with egg donation, often the most effective treatment when ovarian reserve is low. Ovarian stimulation, using gonadotropins to stimulate egg production in women with a reduced number of eggs. Egg freezing, in cases where a woman has reduced ovarian reserve but is still relatively young, egg freezing may allow her to preserve fertility for later use. 6. Other causes of female infertility. A. Hormonal imbalances. Thyroid disorders, hypothyroidism, or hyperthyroidism can disrupt the menstrual cycle and affect ovulation. Prolactin disorders. High levels of prolactin can suppress ovulation. Luteal phase defects, a problem with the second half of the menstrual cycle, leading to insufficient progesterone to support pregnancy. B. Immune system issues. Autoimmune diseases. Conditions like lupus or antiphospholipid syndrome can cause fertility issues by attacking the body's own reproductive tissues. Anti-sperm antibodies. The body mistakenly produces antibodies that target sperm, reducing their ability to fertilize an egg. C. Unexplained infertility. In some cases, infertility cannot be explained after thorough testing. This is termed unexplained infertility, which accounts for about 10 to 15% of cases. 7. Conclusion. Female infertility can arise from a variety of causes, ranging from hormonal imbalances and structural issues to age-related factors and autoimmune disorders. A thorough diagnostic process, including medical history, physical examination, imaging tests, and hormonal profiling, is essential to identify the underlying cause and guide treatment. Depending on the condition, treatment options include lifestyle modifications, medications, surgical interventions, and assisted reproductive technologies, ART, like IVF and egg donation. With the right diagnosis and treatment, many women with infertility can achieve successful pregnancies.